lung cancer is the leading cause of cancer death in the country. But with early detection, survival rates are high. Joining me are Dr. John Neal, chairman of the board at Scottsdale Medical Imaging, Dr. Judson Tillinghast from Arizona Pulmonary Specialist, and Dr. Farley Yang from Arizona Center for Cancer Care. Thank you, gentlemen, for joining us. It's so nice to have three leading physicians groups all in one place. Dr. Neal, let me start with you. Why is there a need for lung cancer screening program, and who should be screened?
Well, you've already partially answered that question in your intro because you stated that lung cancer is a leading cause of cancer death in the country. And, you know, we have screening programs for women for breast cancer. We have screening for prostate cancer for men. Very important things. But lung cancer is still the leading cause of death for both men and women when it comes to cancer. And so it's been a long time coming to have some sort of technology or some approach where we can screen the right group of patients. Importantly, unlike breast cancer, where all women beyond a certain age should be screened, there's really only a subset of patients that we're talking about when we're looking at lung cancer screening. And those are patients that we call high-risk patients. And for lung cancer, typically that means smokers. We know that about 85 or 90% of the patients who will develop lung cancer have a heavy smoking history. And so we want to look for patients with a history of a heavy smoking history. We know that it occurs in older patients, so we screen only patients from age 55 to age 79. And it's also patients who are smoking currently or smoked relatively recently within the last 15 years.
Okay, now, what is a low-dose CD or CT, and what does low-dose mean?
Well, a CT scan is pretty much just a fancy X-ray machine. Pretty much, you know, we use low-dose radiation and computer processing to generate really, really sensitive, high-resolution images inside the body. And in this case, we're using it to look at your lungs. And the doses that we can use with current CT technology and current computer processing are much lower than we used to use, and therefore they're a very low risk to the patient.
And Dr. Tillinghast, let me ask you, what role does a pulmonologist play in this screening program?
Well, pulmonary doctors are physicians that are internal medicine physicians that deal with primarily the lung problems. So we end up seeing patients when they've had a diagnosis of a nodule in their chest, and we're trying there to make a differentiation about whether this lesion is something that needs to be looked at quickly with a biopsy or whether we need to monitor this lesion over a period of time. We live in the Sonoran Valley. Many people here have nodules on their chest that are related to the valley fever, the coccidiomycosis. So a lot of times there's a differentiation that has to be done. Sometimes we biopsy and sometimes we monitor this, and the pulmonologist is a doctor that tries to help you make a decision about that. Second of all, if you make the diagnosis of lung tumor, then you have to make a decision about what goes on and how they're treated.
Okay.
The pulmonologist oftentimes takes the family and the patient, and it's an emotional subject. When you have a diagnosis of cancer, everybody wants to cut it out yesterday afternoon. Sometimes it's not the best thing to do to cut it out because we look at the general picture and whether the patient can tolerate any type of procedure. We look at pulmonary function, see what they will look and try to differentiate some type of idea about how they will function after they have a surgical procedure. Sometimes we find out it's not the best thing for them to do. A nodular density can sometimes be irradiated by Dr. Yang and his group or one of the other groups in town and take care of the tumor, and it won't cause as much residual problem for the patient.
Okay, so Dr. Yang, let me ask you, and as Dr. Neal said, you know, it's no secret that smoking causes lung cancer. Once this screening process happens and lung cancer is detected, what happens?
Well, additional workup often is necessary in order to determine the extent of the disease. But before going into that, I want to say that the detection of lung cancer is really only half of a successful screening program. Obviously, you require a successful treatment of the cancer. Obviously, we detect a cancer that is incurable. There's probably not much point of doing a screening program. But the cure rates for early detected lung cancers are extremely high, on the order of 80 to 90%.
Oh, wow.
So typically, the first thing that will happen is to make sure that the cancer truly is confined to the lung itself.
Okay.
There may be some additional studies that are done, like additional scans such as CAT scans, PET scans, bone scans, MRI of the brain, to make sure the disease hasn't spread elsewhere. If we see that disease has spread elsewhere, the cure rates can be substantially lower. But that emphasizes the point that we really do need to have patients come in early and have their cancers found early.
Exactly. So, Dr. Neal, let me ask you, what advice would you have for someone who is a smoker or a former smoker who may fall in this high-risk category?
Well, I think the advice is get more information. Hopefully most patients have a primary care physician, or if not, can arrange an appointment with a primary care physician. That's really the starting point. There are other resources. We have a website, checkmylungs.com, which patients can go to and get some information. There's a website put up by the United States Preventive Services Task Force that has additional information. So really, if a patient, is watching this and thinks that they might meet the criteria, then they just need to seek information, because Dr. Yang hit it on the head. It's all about early detection. If we catch this early, there's a chance, there's more treatment options, there's a chance of cure. And that's really what we're shooting for.
All right, gentlemen, thank you so much. We really appreciate it. Thank you for coming in and lending your expertise to us. And of course, for more information on Scottsdale Medical Imaging, please go to their website, checkmylungs.com, or call the number you see right there on your screen.